Okay, recording.
What parent would not want the absolute best for their child? Imagine a resource so beneficial that the American Academy of Pediatrics and many other child-based organizations promote it wholeheartedly. Many of us are parents or will become parents at some point in our life. Those of us who are parents understand the overwhelming feelings and the need for our children to be healthy and receive the best that life has to offer. My wife and I recently became parents, and we decided that breastfeeding would be the most beneficial to our child. The purpose of my speech is to persuade mothers to breastfeed, or to persuade men to encourage their partner to breastfeed when having a child. I believe that women should breastfeed for 3 reasons: the health benefits of the infant, the developmental and psychological benefits of the infant, and the health and economic benefits for the mother. Breastfeeding provides many health benefits for the infant during and after breastfeeding has ended. According to New Mother's Guide to Breastfeeding, human milk provides antibodies, enzymes, white blood cells, natural immunities that formula cannot provide. The mother passes on the antibodies that she has developed through her lifetime, passes them on to the child. Many times breastfed babies overcome colds and sickness quicker because of the antibodies that have been passed. Antibodies passed through breastfeeding decrease the child's chances of contracting many infectious diseases and/or illnesses, including diarrhea, ear infections, vomiting, pneumonia, some forms of meningitis, and many other illnesses. Rebecca D. Williams states in an article on the Food and Drug Administration's website that human milk has around 100 more ingredients found in that breast milk has 100 more ingredients than formula. Infants are not allergic to human milk. They may have a reaction to something in the milk, but this can be changed easily by the mother's diet. The United States Breastfeeding Committee discusses the decreased risks of breastfed infants suffering from cancers such as childhood leukemia and Hodgkin's disease. The chances for developing diabetes, asthma, and eczema are also lower in breastfed babies as well. The baby is less likely to suffer from sudden infant death syndrome if he or she is breastfed rather than formula fed. Breastfeeding allows for many psychological and developmental benefits for the infant. Great Expectations, a guide to enjoying your pregnancy, points out that breastfeeding stimulates a special relationship between the mother and the baby. The infant benefits from very special bond and the warmth and closeness felt while nursing. A New Mother's Guide to Breastfeeding states that the brain development is most rapid and crucial during infancy and early childhood. Breast milk contains specific forms of fat that are vital in the development of the brain and brain pathways. The Leche League International advocates breastfeeding. Children who are breastfed have proper jaw, teeth, and speech development. Jaw development is strengthened through the harder work from sucking on a nipple rather than a bottle. Studies have also found that babies score higher on tests and have higher IQs than bottle-fed babies. Breastfeeding is not only beneficial to the infant, but also to the mother. The mother has many health benefits and economical advantages. According to the United States Breastfeeding Committee, breastfeeding mothers are more likely to lose weight quicker after delivery. Breastfeeding contracts the uterus, causing it to return to its normal size, reducing postpartum bleeding, allowing the mother to recover at a quicker rate. Breastfeeding mothers also have a reduced rate of developing ovarian and breast cancer, as well as osteoporosis. Although not 100% effective, breastfeeding exclusively can also be used as a form of birth control within the first 6 months of delivery. The most obvious economical advantage to breastfeeding is saving money on formula. According to the U.S. Breastfeeding Committee, formula can add up to $1,200 a year, as where breast milk has an expense of the nursing mother's diet, which is an estimated $300 more when the mother is breastfeeding than when she is not. Another economical advantage is not losing money because not having to miss work to take care of a sick child. Children who are breastfed are less likely to get sick earlier in their childhood. Healthcare costs are also decreased. A healthy baby means less trips to the doctor and to the hospital. The purpose of my speech today is to encourage and promote breastfeeding. Breastfeeding has many